Hey, good optometry morning. If you want to treat your Meibomian gland dysfunction, you need to treat these four things. You need to treat the lids, you need to treat the inflammation, the obstruction, and address nutrition. Hey, I'm Dr. Michael Nelson, your YouTube eye doctor, and today I'm going to be telling you about the products that I recommend the most to treat Meibomian gland dysfunction. But before I do that, I just want to clarify that this is not a sponsored video and I have no financial interests in the companies or the products that I'm mentioning in this video. However, I will be putting some affiliate links in the description down below of these products, which I may receive a small commission if you end up purchasing any of those products. All right, so Meibomian gland dysfunction, that's the #1 cause of dry eye disease. And the main root of the problems are problems with lid hygiene, inflammation in the glands, obstruction of the glands, and then nutrition that you need. Now, I've got a whole video explaining in detail about Meibomian gland dysfunction, what it is, and if you want to watch that, you can look at the link up above. But in this video, I'm going to be talking about my favorite products, or the products that I recommend most to my patients that I find that they get success when they're treating their Meibomian gland dysfunction. All right, so #1, lids. Meibomian gland dysfunction is often associated with an increased number of bacteria in and around the lids. Now, we have normal bacteria that live on our lids, but if you have too many of them, then they can produce waste products which are inflammatory and can contribute to the dry eye cycle. So to get rid of those, we want to bring the bacteria count down, but not get rid of them completely. So to do this, we will often use lid wipes. And these are something to clean around the lids and get off those inflammatory waste products off the surface of our eyelids. And the product I usually recommend to my patients to clean their lids is this product right here. It's called BLEPHACLEAN. And BLEPHACLEAN has individual lid wipes. So you basically open up the little package, and in it, it has a medical grade gauze that has some natural ingredients on it that help kill the bacteria and clean the surface of your eyelids. Now, I love this product because it's preservative free and it has all natural ingredients. And studies have shown that using this product twice a day for 5 days will reduce the bacteria count on your lids by about 63%, which is a big deal. And though this product is often used before eye surgeries to help in the cleaning process of the eyelids. It's a great makeup remover, and the thing I love most about it is that it's not foamy and soapy like some other lid wipes are. So you can wipe and clean your lids, and you actually don't have to do anything after that. You don't have to wipe it off or rinse it off. You can just leave it and go. Now, you may have heard from someone to use baby shampoo to clean around your eyelids. Now, that's something we used to do probably about 30 or 40 years ago, but we don't recommend it anymore because studies have shown that baby shampoo actually can be irritating to the tissue on the lids and on the surface of the eye, which can actually contribute to dry eye. So you're better off using a lid wipe that's specifically designed for your eyes. All right, #2, inflammation. Now, inflammation in the Meibomian glands can cause those glands to not produce as good of quality tear film. There's a whole cycle that goes on, and there are some prescription eye drops that are designed to stop that inflammatory cascade that's going on in those glands to allow those glands to start to work properly. Now, there's 3 products that are on the market that can treat the inflammation. One is called Restasis, one is called Cequa, and another one's called Xiidra. And all of them work in a little bit different mechanism to break that cascade. Studies show that they're all pretty effective in doing this, and one's not necessarily better than others, but they are definitely different. So they are a prescription product, so your doctor is going to have to prescribe them, and which one you choose might depend on your drug plan and which one's covered by that plan. Now, the important thing to remember about these products that are treating the inflammation, these 3 products, they are not a cure, they're a treatment. So as long as you're using, they're going to disrupt that inflammatory cycle, but once you stop using them, that cycle is going to come back. So these are intended to be used long-term and indefinitely, but they can definitely reduce your dry eye signs and symptoms. All right, #3, obstruction. If the oils in your glands get thick, they can block the glands and prevent them from flowing as well, and then the glands can start to atrophy, and that's not a good thing. So what we need to do is we need to soften up those oils to get them flowing better. And the way we do that is through heat. And if you can heat up your lids enough, you can get those glands flowing better. Now, the tricky part is those glands are relatively deep into the lid. You need to heat up your lids to a target eyelid temperature for a period of time in order to get those glands flowing. And the target numbers are you need the lid to be at about 40 degrees Celsius for at least 5 to 10 minutes in order for those glands to start to work. And so what we need is we need warm compresses to our lids for a long period of time. So you need something that's going to hold the heat for quite a while. Now, some people will recommend hot compresses, but they cool off within seconds. So the two products that I like best, there's one called a BRUDER mask. It's like this little mask filled with seeds, and you heat it up in the microwave for 20-30 seconds, and then you put it on your lids. This can hold the heat for up to 5 to 10 minutes. Great option to have. Another great product is something called the BLEPHA bag, and the BLEPHA bag has a little bean bag, and it sits on your face as well. It's got two sides, a silver and a black. One's a little bit warmer than the other. Both of these products are really great for keeping the lids warm. So the key is you need the lids warm up to 40 degrees Celsius for 5 to 10 minutes, and doing that once or twice a day can help get those glands working. And if you're doing that on a consistent basis, those glands can start working better. And number 4 is nutrition. And when I talk about nutrition, studies have shown that omega-3s can be useful in stopping the inflammatory effects of the gland. So omega-3s, if you have the right type and the right amount, they can reduce that inflammatory effect. So if you go to the store, you're going to see a wide variety of omega-3s and a wide variety of price points. You got to make sure you get the right one, because if you're not taking the right one, you might be better off not taking any at all. So there's two main types of omega-3s. There's the ethyl ester type, and then there's the re-esterified triglyceride type. The ethyl ester is probably the more common type, but it's a cheaper one to make, and that's the one you're going to often see in big box stores and supermarkets. But the problem is the form that omega-3 is left in is not really bioavailable, which means it doesn't really absorb into your system very well. So most of it goes right through you. So you might be thinking you're taking the right dose, but you're not getting a therapeutic dose. So the type that you want to look for is re-esterified triglyceride. If it doesn't say re-esterified triglyceride, it's probably not. So on the label you might see re-esterified, but it may just say triglyceride or TG omega-3. And so the triglyceride form of the omega-3, that has a form which will absorb into your system at therapeutic levels if you're taking the right amount, and you need about 2,000 milligrams per day. The other thing you want to look for is the EPA to the DHA ratio, and you want either 2-to-1 or better yet 3-to-1 ratio of the EPA to DHA, and that will give you a level that over a month or two will start to reduce the inflammatory effects of the lids and reduce your dry eye signs and symptoms. Now, the product that I recommend most for this, because I know it meets all those criteria, is the PRN DE3 omega-3. And I like this product because it has all those criteria to treat your dry eye disease, but it also doesn't have any fish aftertaste, so you don't get those fish burps after taking it. You need to take 3 capsules of this per day. But the other thing that I like, it is also available in a liquid form. So if you have trouble taking gel caps, you can take 1 teaspoon of the liquid and get the same effects. Now, if you have really severe dry eye disease and you're not able to manage it with some of the at-home products that I've mentioned here, then you might need some in-office treatments. And if you want to learn a little bit more about that, you want to watch this video right here. And with that, have a great optometry day.